Are you waiting for more folks to come in?
I think,
great.
Yeah.
Let's start.
Perfect. All right, well, listen, greetings, everyone. And we're also glad that you could join us for what I think is going to be an extremely interesting panel. I'm Carl Pelimer. I'm a faculty member at Cornell University in the Department of Human Development and in our medical school, and have worked with Peter Lloyd Sherlock on some of these issues in the past. And again, I'm really pleased to be here. As a little bit of background, this session is part of a COVID-19 webinar series that's being co-hosted by the Lancet COVID-19 Commission and the UNICEF Global Development Commons. This commission is composed of 14 task forces. Represented on this webinar is the Task Force on Social Protection, Humanitarian Action, and Vulnerable Groups. And the discussion this morning is going to focus on the topic of COVID-19 and intergenerational equity. I've been asked to let you know that all the materials related to the webinar can be found on the Global Development Commons at gdc.unicef.org. The GDC is an open access digital platform that aims to crowdsource evidence and innovations to support the child-focused SDGs and is publicly accessible for contributions. We are incredibly pleased to be able to kick off this webinar with a presentation from the chairman of the Lancet COVID-19 Commission, Dr. Jeffrey Sachs. He may need no introduction to many of you, but let me say that Dr. Sachs is a university professor and director of the Center for Sustainable Development at Columbia University. He's president of the UN Sustainable Development Solutions Network and a commissioner of the UN Broadband Commission for Development. He's been advisor to 3 UN Secretaries General and currently serves as an SDG advocate under Secretary General Antonio Guterres. He spent over 20 years as a faculty member at Harvard and has authored numerous best-selling books. His most recent book is The Ages of Globalization, Geography, Technology, and Institutions, which I can attest is a great book. He was twice named as one of Time Magazine's 100 most influential world leaders and is ranked by The Economist among the top 3 most influential living economists. So it's a tremendous pleasure. And Dr. Sachs, please take it away.
Carl, thank you very much. Thank you for the warm introduction. Thank you to colleagues at UNICEF for co-hosting this webinar with the Lancet COVID-19 Commission. I'm just getting off of another call looking at the implications of Delta for containing this pandemic, and the basic conclusion was we're still in the middle of a struggle that remains extraordinarily difficult. I think we certainly were hoping that by now we would be talking about the post-COVID recovery. We're far from that. We are in a world of raging virus, new variants, of course, international systems that are not working, nationalism and incompetence everywhere, pervasively, I'm afraid to say. Vaccine coverage in Africa, as of today, is 3% of the population. That's a failure of the global system to basically ignore, which is, I think, the right word, such profound inequities as well as danger of leaving large parts of the world without really any effective protection. So the situation is not good. And I would say in general on the challenge of intergenerational equity, where sustainable development is our hallmark, and the Sustainable Development Goals and the Paris Agreement and the Convention on Biological Diversity to stop the loss of biodiversity are all our common guideposts. You can't find really much good news on any front. The SDGs are wildly off course. They were off track to begin with, but COVID knocked them completely for a loop. The climate crisis accelerates as we've experienced in 2021 with massive climate-related shocks all over the world, still raging forest fires, droughts, humanitarian catastrophes, extreme storms, Hurricane Ida, which took many, many lives and created a massive swath of destruction in the United States, and similar disasters in other parts of the world. We don't have a functioning international system right now. Unfortunately, my country, the United States, just lost the melody somewhere in the last 20 years of being a good cooperative, contributing problem solver. I don't mean at an individual basis. I mean our government basically, even when we have a nice president and a good president and an administration that I like, we don't cooperate effectively. We seem to alternate that with psychopaths like we just had, and that makes the whole situation far, far worse. So I think the backdrop for our discussion is really a difficult one, frankly, where the pandemic is raging. The international system is very shaky, and we have to ask what to do and how can we actually find a way out. Perhaps well, certainly the element of hope in all of this is that the world is more characterized by having solutions that we ignore than by not having solutions. So in just about every challenge that we face, there are lots of things we could be doing that we're not doing. And that is distressing, perplexing, frustrating, but it doesn't lead to hopelessness. It leads to some puzzlement. Why aren't we doing the things that could take care of ourselves? Why do we have US governors who think it's their mission in life to stop children from wearing face masks? It's a puzzle, but it doesn't really end, it doesn't really eliminate for us the fact that we have face masks, we have vaccines that could be scaled up. We certainly have other tools for intergenerational equity. They're called schools, they're called clinics, they're called community health workers, they're called UNICEF programs. We have multiple ways to approach these issues that we are not doing right now. Okay, so what to do? I'll just give you my little strategy on this, or my own way of thinking. The good news in all of this is that by some quirk of fate, the world has actually agreed on the right things to do, rhetorically, that is. We have agreed on a UN Framework Convention on Climate Change and a Paris Agreement to keep temperatures below 1.5 degrees C, to keep the warming below 1.5 degrees C. We have agreed on a convention on biological diversity to slow and then halt and then reverse the loss of biodiversity in the world. We have agreed on 17 wonderful sustainable development goals because, my God, not only did all 193 countries agree on these, but they're actually quite wonderful when you think about it. End extreme poverty by 2030, end hunger by 2030, ensure universal health coverage by 2030, make sure that all children are in school all the way through upper secondary by 2030, gender equality, safe drinking water, access to renewable energy, you name it. Good, solid goals agreed by every country in the world on September 25th, 2015, to apply by 2030. Okay, that solves one problem. What are we supposed to be doing? Well, we've agreed on what we're supposed to be doing. All the rest is a little bit shambolic because we don't do it, but still we've agreed on what we should be doing. So my way of thinking is that our real work is to accomplish what we've agreed to do. Actually, not to give up on what we've agreed to do, not to lose sight of it, not to let it fritter away, not to let it simply atrophy, but to say repeatedly, we have agreed on the following things. Now, where the hell are we on doing something about it? And where is your responsibility? When I say you, I mean you, President Biden, or you, the European Union, or you, other leaders in the world. What are you doing? Because you're there for this purpose. And that, to my mind, is the only way we're going to get out of this mess, is to keep our eye on what we said we want to do, or in the very nice phrase of the UN, building the future we want, which I really like as a good idea. And the other good idea that I like is leaving no one behind. So I think the UN's really good at making phrases, which is important because it can bring the whole world together. But then we need operational capacity. So what's the problem with the operational capacity? The problem is that the agencies like UNICEF or WHO or others that have the operational capacity are profoundly underfinanced to do their job. So all we do is beg for money. We beg for capacity and beg for attention, which competes with the major powers. And the United States, first and foremost, ignores the United Nations system. Sad to say, it founded it, it hosts it, it is still the largest single donor, and then it ignores it. And that is a huge problem, because we can't have solutions to global problems if we are not funding the solutions and not operationalizing the solutions to these problems. And what is sure is that we can't solve these problems through bilateral means, a US team going to 130 countries. That's UNICEF's job. That's not the US government's job. And we can't make global norms by one country dictating them. That's why we have the international system. And we can't finance these by a powerful country or a few saying, well, this is our favorite here, or we'll give you a little bit of vaccine here if you agree with us on something else, so that it becomes partly a game rather than a system. That's why COVAX was supposed to get vaccines for 100 countries and distribute them. But the problem is nobody gave COVAX the vaccines to do that. Pfizer and Moderna and others went off and made their private contracts, and our governments didn't deliver. And here we are, which is nice words, nice commitments, and a complete failure, not complete failure, but a failure of action to this date. So I think I don't have an alternative other than trying to get serious on accomplishing what we have said we would accomplish. I like using the SDGs not only as a rhetorical compass and not only as a flourish to say, wouldn't it be nice, but also as an operational standard. So we've said, as an example, where UNICEF plays a central role, that every child should be in school and completing an upper secondary education by 2030. That's SDG 4. So just take that for an example. Is that on track right now? Of course not. It's unbelievably off track. It was off track before COVID. There were probably 250 to 300 million school-age kids not in school in 2019. Now it's probably up to 1 billion. because of the disruptions coming from COVID. So what are we going to do? That requires an operational plan. Who can make that operational plan? Really, only two places, actually, UNESCO and UNICEF together, because they're the two international agencies charged with getting kids in school. Where's the plan? There isn't a plan right now. Certainly no governments have asked the agencies to make a plan. And if the two tried to make a plan, maybe they'd be told, don't make a plan. We don't have the kind of funding that you need actually to operationalize the plan. My view is we need that plan. We need a clear, we have basically 8 years. We need a plan. How are we going to get the kids back in school? Some online, some in person. We really don't want to lose a generation of young people, which we will do. And if you lose 2 or 3 years of school, it can be devastating for a lifetime. And we're on the verge of doing that right now. And you know what? Maybe it costs an extra $100 billion to implement this plan. And I can tell you, that's not very much money. The United States just spent $7 trillion on its emergency COVAX response. I can tell you that the billionaires in the world have about $15 trillion of wealth. That's 2,700 people, $15 trillion of wealth. So 3 or 4 of them could provide the 100 billion without breaking a sweat, actually. And the group as a whole could fund all of these solutions. Isn't it incredible? 2,700 people, $15 trillion of wealth. 1% of that a year is $150 billion. And we consider this civilization. When the kids are not in school and when they don't have safe drinking water, they don't have the nutrition. And if UNICEF needed to do more, it couldn't get the funding to do it. So we need plans and we need the financing behind this. And we cannot rely on individual governments to do this on a voluntary basis. We're beyond that. We are a global, interconnected world. We have politicians who are national, not very much aware. It's not their job. If they were elected by a global constituency, they'd know a lot more about the world. They care about their own local base, and yet our problems are global. So that's why I am in favor of a strong United Nations that makes clear and realistic plans, not what we do now, which is to be told, well, we can probably get you an extra $500 million. What would you do with it? What we need is a plan that says we need $50 billion and here's what we're going to do with it. And then mobilize this financing. So let me just end with this question of the financing, because I don't think it's as crazy as it sounds. The world economy is $100 trillion a year. That's our annual output. So I recommend always use that as your denominator if you want to know whether something's large. So if you want to know, I need an extra $100 billion a year, it's easy for the moment because we have round numbers we can use. 100 billion out of 100 trillion is 0.1% of world output. I can tell you as a general principle, we can always afford 0.1% of our income or of the world's income. Another denominator I recommend is 15 trillion. That's the wealth of the billionaires who have gotten phenomenally wealthy during COVID because the money has soared to the online platforms. They don't pay tax, by the way. Just if you have any question, they don't pay taxes because they get their income in capital gains and that's untaxed in the US. Oh, what a coincidence. Well, that's how our plutocratic system works. So they could afford a lot. So I believe we need to turn the logic around and say, what are the things we need to do? The IMF has done a good job in the last couple of years of calculating the financing gap. It's about $300 to $500 billion a year. As a macroeconomist, I yawn. Okay, that's 0.3 to 0.5 of 1% of GDP to handle all these crucial world questions. That's not even 1%. My God, what am I wasting my time on? But the point is, it's not a lot of money. We need to tally up the needs, and then we really need the basic systems for delivery. Some of it should go through operating UN systems like UNICEF or World Food Program or other frontline agencies. A lot of it should go through the multilateral development banks, the World Bank, the Inter-American Development Bank, the African Development Bank, the Asian Development Bank, the Islamic Development Bank, and so forth. And there are other special modalities. I believe that the Global Fund to Fight AIDS, TB, and Malaria should join with Gavi, should open a new pandemic window as well for basic health systems. So we should have a global health fund that actually in a unified way addresses SDG 3. We need a global education fund because we're underfunding primary and secondary education in low-income countries by about $50 billion a year. And so we need a global education fund, not the Global Partnership for Education, GPE, which is a tiny organization, which maybe reaches $1 billion a year at most. They don't even reach that. I'm talking about $50 billion a year. So this is serious global governance that we need. I'll end by where I started. The practical solutions are in front of our eyes. In fact, all of us are practitioners. We see, we know that this is within reach, having clinics, schools, online teaching, vaccine coverage, other things. This is really feasible, but money drives this process, and the money is not being directed towards the goals that we've stated. And that, I think, at least from my perspective as an economist, that is the most basic problem of all, not the what to do, not even the how to do it, not even the who to do it, but the how we're going to pay for it. And my point as an economist is it's not very expensive. So if we mobilize and hold these politicians to account and show them the real bills, not the ones they want to see, I think we're going to make a lot of headway. Thank you very, very much. Thanks for today's session.
Oh, well, thank you so much. And I can't think of a better way to introduce this. I understand, Dr. Sachs, you're not able to stay with us the entire time, but I am sure that your comments and thoughts are going to be taken up in the discussion. Great. So again, thanks so much for joining us and framing this session. That was extraordinarily helpful. And we're glad you could be with us. And I'm glad you gave us, a little bit of a glimmer of hope there. So that's a positive aspect. So thank you for that as well.
Great, thank you.
Thanks, Jeff.
Thanks again. Thanks very much. Well, with that, it's a hard act to follow, but I know that our next two presenters are clearly clearly up to the task. I'm briefly going to introduce both of them. We would encourage you, because of the time frame and organization, if you can put any and all questions or comments in the chat, and we'll be reviewing that, and we'll use that for the question and answer period. Obviously, the group is a little too large to allow a full open forum. So if you could please put your questions in the chat, that would be great. Our two panelists, Peter Lloyd Sherlock and Natalia Winder-Rossi. Briefly, Peter is a professor of social policy and international development at the University of East Anglia. His work is primarily devoted to understanding older people in low and middle income countries and looking at issues of health and long-term care for such individuals. He leads a number of projects, and I know in the US and from other folks globally, his creation of a global knowledge hub on COVID-19 has been phenomenally helpful. And he has recently been publishing a number of papers in Lancet Global Health, Lancet, and the British Medical Journal, and others on this topic. Natalia is the Associate Director and the Global Chief of Social Policy at UNICEF's Program Division, overseeing the organization's work on child policy and social protection and public finance management for children and local governments. She also worked previously in very similar areas. And prior to this, she's also served as the Senior Social Protection Specialist at UNICEF's regional offices in other regions. She's also worked on the Inter-American Development Bank on social development and education. I could go on longer, but I'm sure you want to turn to the presentations. I have you in the order of Peter and then Natalia. Is that correct? Or, all right, Peter, over to you. And yes, and again, please include your questions, including those raised by Dr. Sachs's presentation in the chat. Thanks.
Hello. Thank you so much, Carl, for that very kind introduction. Bear with me. So today I'm going to share with you some very preliminary thoughts about COVID and intergenerational equity, and about why I think intergenerational justice has always been a very important issue, and of course has become even more so during the pandemic. My arguments are really very exploratory, and my aim really here is to try and provoke some thinking and some discussion among my audience. And so I'm going to argue that despite what Jeff said, which I entirely agree with, I do think there are some complicated puzzles we need to engage with in terms of how we try to address intergenerational justice, both intellectually and in terms of how we do policy process. I'm not entirely sure what these new ways of doing things might look like, but I think they include talking to experts and people as professionals we don't always talk to, and talking to them in new ways. For example, how someone like me, who exclusively works on older people, can talk to people who work on other things, like many of my audience today. This might seem a rather abstract, academic, blue skies kind of issue, so I want to start off with a quick real-world example. As I was putting my talk together a few days ago, I came across this article in the UK's Guardian newspaper, and it refers to a major reform of social care funding in the United Kingdom. Although the reform isn't framed as being directly or specifically related to the pandemic, it is very strongly framed by the pandemic in terms of pressures on health and social care services and increased public debt in the UK. And the article observes that older people are usually a lot more affluent than younger generations, but complains that the main burden of paying for social care will fall on people during what they call their working years. And it proposes that any starting point for a reform of social care must be fairness. That seems a fairly obvious point to me, and I'd be surprised if anybody said fairness should not be central to any public policy reform. A much more difficult and vexatious question is, what do we actually mean by fairness when we're looking across different generations? We all have a broad sense of what intergenerational justice might look like, but in fact, it's an extremely complex and involved issue, and it's open to different interpretations. I've sometimes grappled with this a bit over the years as part of my research on older people. And at the same time, like all of us, I've been exposed increasingly to a powerful narrative in the media and in public discourse that's become very prominent in recent years, especially in richer countries, but not exclusively in richer countries. And in this image, I tried to capture some of the basic elements of that narrative. I think it's a narrative that's already familiar to most of you and doesn't really need specific explanation. One key part of this discourse is that the interests of different age groups are fundamentally opposed to each other, and that these opposed interests are mediated by political and economic resources held by each group. Because older people, it's claimed, control more of these resources, they tend to do much better than people at other ages. And so the argument goes that there's an urgent need for some kind of rebalancing in what you might call this intergenerational tug of war. There are, of course, a lot of problems with this simple narrative. For example, it's not at all gendered, it's not at all intersectional, and it's based on monolithic, very generic depictions of different age groups and what their interests might be. Yet many people, including academics, would argue that it contains at least a grain of truth. And we all know that these issues became much more urgent and immediate during the COVID pandemic and continue to be so. Again, I think this set of images speaks for itself. And in relation to this, we know that policymakers have faced impossible dilemmas about how to try and reconcile the needs, rights, and interests of different groups, of different age groups. And generally speaking, they've not had use of frameworks, guidance, tools, ethical principles to help them resolve these dilemmas. And thinking about this spurred me to write a short piece that came out in The Lancet at the start of the year. Its observations mainly relate to high-income countries, but I'm somebody who does most of their research on low and middle-income countries, and I think, particularly in middle-income countries, there is a lot of truth in these observations. So I argue that many countries in the world are already facing growing crises of intergenerational justice before the pandemic, that there was much less consensus about what was fair. And this we can see in lots of different ways. Pressures on public services, limited access to secure lifelong employment for people of different ages, growing generational gaps in access to housing markets and other opportunities, new gender roles, new family structures through the life course. And I think we can link to this some of the issues that Jeffrey was just talking about in terms of harms to future cohorts resulting from the choices and the behaviors of current generations. Now, identifying these issues, putting them in a list is one thing, but doing something about them is quite another. All of these issues in this list are highly complex and difficult issues individually in themselves, but they also interact with each other in many ways and they operate at different levels. So where do we even begin to relate and come up with intergenerational solutions to these problems? Perhaps there are a couple of things we could do as a starting point. First, I would argue that there's a real need to build what, for want of a better word, we might call a brains trust, to try and critically deconstruct established ideas about intergenerational relations, the way things have always been and will always be, most of which are now out of date. Also, to develop new concepts and ethical tools to guide policy responses to those impossible dilemmas, be it in relation to COVID or wider dilemmas. And hopefully, as a part of that in the longer run, to contribute to a process of developing new consensuses of generational justice and sustainable development. I feel that to do this will require new ways of thinking, quite radical new ways of thinking. Secondly, I think we can start to develop right now, and hopefully this could be part of that, more joined up processes of agenda setting and advocacy. Global agencies and experts they often work with tend to focus on the needs and rights of specific groups, of specific issues. And this also often happens at the national level too, not just globally. I think we're all aware of the idea of echo chambers, social media powered cycles of interaction and reinforcement of specific worldviews, shared interests and opinions, and often with very little interaction beyond these echo chambers with people who may hold very different perspectives. I certainly know I'm part of one of these. 99% of my professional time is spent engaging with people who are interested in old people. This morning, a colleague, who of course works on older people, tweeted me about a new paper calling for an international convention on the rights of older people. The paper was published in a journal exclusively focused on aging. I like it inside my echo chamber. It's a safe space. And certainly during the pandemic, I haven't spent much time outside it. I don't go personally into university anymore, so I don't rub shoulders with colleagues and other people who do other kinds of things and have other perspectives and other views. That saying, a few months back, I was involved in some very interesting discussions as part of the Lancet Task Force on Social Protection and Vulnerable Groups. And I was the only one with a particular focus on older people. And so this forced me to hear the thinking and try and engage with people I don't usually interact with professionally. And this is how it felt to me, this image. I was in my own echo chamber, but I was obliged to try and engage with people in completely different echo chambers, each focused on a particular issue, all arguably as important as each other: children, younger adults, exploited workers, etc., etc. And each group with a tendency to see their own issue of having primacy and to some degree championing that cause. And to some extent, this all felt a bit like a negotiation rather than a process of collective thinking. Within that, age was seen as a shorthand for representing the interests of different age groups, rather than something that flows through and affects everything we're all interested in. And this included a tendency, and I think I did this as well, to focus on the interests of specific groups, our favorite causes, our favorite groups, without considering the opportunity costs for other groups and causes. So in many ways, it felt like we were reinforcing, we're reenacting this idea of a zero-sum tug of war. And perhaps rather than refereeing this process of brokerage, what we needed to do was find some shared parameters of what is fair, of what is just, and to recognize the effects on other groups of what we advocate for our own favorite groups in a context of resource scarcity. As I said, I know I'm as guilty of doing that as anybody else. But in the last few months, I've been working with some other people to try and do things a bit differently and to adopt a more objective approach to evaluating what might be fair or unfair, with reference to particular COVID health interventions. And to do this, we apply a very simple criterion. How can policies save more years of life? In the early years of the pandemic, the availability of acute care was extremely limited relative to people's need. And that continues to be the case in many low and middle income countries today. At the same time, it's been widely documented that people at older ages did not always have the same access to these acute care services as younger adults did. They had a lower priority. So was that unfair on older people? I think the answer to that question is complex and very context specific. But one key issue is that on average, treatment outcomes for people at very old ages are much less likely to be good than for people at younger ages, especially in intensive care. So in our paper, we accept that in a context of crisis management and a need for brutal pragmatism, it could be argued that providing less access to acute care for older people maximized the overall number of lives that could be saved. If that were the case, then at least in some senses, it could be argued that this approach was not inherently unfair. I have to say, many people working in my own personal echo chamber would be very, very unhappy with me saying that. I also want to point out that this does not include cases where the reduced access to acute care for older people was really quite extreme. For example, a study of a teaching hospital in India showed that the average age of people being admitted with COVID was 33.5. In that case, I think it's extremely unlikely that years of life saved were maximized. Looking at another COVID policy, I'll look at just one more, vaccination. Approaches to prioritizing who gets vaccinated have varied considerably across different countries. And there's been particularly large amounts of variation across low and middle income countries, both in policy and in practice, in terms of the priority given to older people versus other groups. For example, Brazil, despite its many problems, has been very successful at rolling out vaccination across its oldest age groups. It's achieved almost universal coverage, and it did this quite early in 2021. By contrast, in mid-July in India, over half of older people were yet to receive a single dose of vaccine. And over the previous 2 months, more people aged under 45 were being vaccinated than aged over 60. And the vast majority of those people under 45 were not frontline health or social care workers. And broadly speaking, what you've seen in India over the last 3 or 4 months has been a process of targeting based on wealth rather than need. Similarly, in the Philippines at the end of June, about 8% of older people, 9% of older people were fully vaccinated, but the government was very openly stating that its focus of vaccination was then shifting towards what they call working age adults to restart their economy. In this story, unlike the case of acute care, the approach of countries like India and the Philippines will obviously not maximize years of life saved. Quite the opposite. It will greatly increase overall COVID deaths because people at older ages are much more at risk of dying when they're infected, as we all know. It could be argued that saving several lives of people aged 80 does not equate to saving the lives of several people aged in their 30s, because of course, people aged in their 30s could expect to live a lot longer, all things being equal. It's possible to factor in this issue by putting together both the total number of individual lives we save and also factoring in the amount of expected remaining years of life that people would have at different ages. There's a metric that combines these two things. Epidemiologists refer to it as a life year. A study that does this for 3 different countries finds that focusing vaccination on the oldest doesn't just maximize the total number of lives that are saved, but it maximized the total number of potential remaining life years in these populations. So it saved life expectancy as a whole across these populations. And as such,
Peter, I'm just breaking in to share. This is the most unpleasant task of a moderator. Since we're running a bit behind, we're going to have to truncate a bit. I think we're in our last minute or two for your presentation.
Okay, no worries. As such, I think it's very difficult to find a robust justification for what's been done in countries like India and the Philippines. And in our paper in next week's Lancet, we go so far as to refer to these policies as state-sponsored geronticide. These are just 2 examples of how it might be possible to apply some simple but maybe objective criteria to work out what might be considered to be fair across different age groups, not just looking at one age group. The challenges of assessing fairness with regard to many other issues are often even more complex than this, and that's certainly the case with long-term care. It's an issue about older people, right? Well, no, as we saw with the quote at the start of my talk, we have to ask who pays, who does the unpaid caring, who does the paid caring, and isn't there a wider need to rethink gendered care economy as a wider intergenerational endeavour? Oh, and by the way, needs for long-term care are far greater in low and middle income countries than in wealthy countries. This is a global issue. In terms of the UK, the policy change has been complicated. It does create a larger burden on paid workers. But in fact, the key issue driving this policy in the UK was actually inheritance. What the reform does is it saves wealthy old people from having to draw down on their wealth, their savings, and their assets to pay for their care needs. And so this means wealthy individuals can pass that wealth on to their children. So inheritance is another key part of intergenerational justice and something we often don't talk enough about. Okay, I hope I've been able to persuade you that intergenerational justice really matters and we have to engage with it directly. It's complex, it's challenging, And I think we need new intellectual insights and policy processes to help us find consensus and new ways of doing things that might be in the interests of all generations. In my own echo chamber, several people talk about the need for a new UN body to represent specifically the interests of older people. But doesn't that just reinforce the current approach to these issues? My preference would be for something like a UN Commission on Generational Justice as part of a new, stronger UN, starting with a blank piece of paper with open minds and sharp pencils. So thanks for bearing with me. Your responses, I'm very much looking forward to them. I think they'll help me decide if there's much mileage in trying to develop these ideas further. Do you think I'm just being too abstract? Am I just being a dreamer? Or is this what we need to start thinking about much more carefully if we want to build the future we want? Or should I just go back to my own day job and my own cozy, familiar echo chamber? Thank you.
Thanks so much, Peter. I can attest that, oops, my camera went up. I can attest to that no one wants you to go back to your day job. I think, although I know this has been kind of an all-consuming task for you. So, but we hope that you will keep it up. And I think the upcoming editorial is incredibly thought-provoking. Thanks. And again, sorry to truncate folks' times a little bit. I think everybody here on the panel too is willing, if we have questions that can't be dealt with here, to email them, and please do put your questions in the chat. That would be really helpful. Natalia, let's turn it over to you. Are you sharing slides as well, or?
I am, yes. If my ability in technology
There
allows me, I'll try my best. Although,
thanks, and again, I'll let you know.
Just 1 second. Bear with me 2 seconds. I'm learning these new things. We've done Zoom, I don't know how many times, but it's always.
Well, it looks great.
But I think they wanted me to put it in the broader screen, but this display settings is not working for me. But if you can see it okay, I can start if that's fine with you. Sorry, I just trying to put it in wider screen. But first of all, good morning, good afternoon, colleagues. Many thanks for the invitation and the opportunity to exchange views. Definitely two very tough acts to follow. But I think my comments are very much aligned to what has been said before in the context of intergenerational equity is definitely not a new concern or issue, but definitely maybe a much more urgent one given the current context. So I'll share some reflections from UNICEF perspective and happy to open up to questions afterwards. If these things move. Okay. So maybe to start, and I think aligned to what Professor Sachs said at the beginning, as a UN agency working for children, we are committed, and we've been committed for more than 75 years to ensuring that every child has a fair chance in life, but always with intergenerational perspective, understanding that inequality starts with the lottery of birth. We know, who our parents are, where we're born. This definitely accounts for the vast majority of variation in the resources and opportunities that are available to us. We know from vast experience and evidence that childhood poverty can be devastating immediately, but also can have lifetime of impacts. The effects of deprivation in terms of malnutrition, poor education are definitely and can be intergenerational. And definitely the experience, unfortunately, also shows that the pandemics and recessions and the different policy responses to those that in past crises have been maybe in the form of austerity or cutting budgets, also further exacerbate these inequalities, not only from an economic perspective, but also from a socioeconomic perspective. Even before the pandemic, the situation of children was very complex. Extreme poverty had declined modestly, but also at a slower pace than adults. And sometimes we don't realize that we have a very different flow and trend in terms of child poverty versus adult poverty. According to a study that we did with the World Bank, we understand that even pre-pandemic, 1 in 6 children were living in extreme monetary poverty, struggling to survive on less than $1.90 a day, showing that children are twice as likely to live in poverty than adults, that poverty risks are the highest among the youngest children, so particularly from 0 to 4, and that this is affecting most prominently children living in female-headed households, as well as those in fragile and conflict settings. And considering, I think, this very well-established but also alarming facts, a key concern that we've had since the start of the pandemic is that how much it will continue to further, if you want, exacerbate how many children will be now living in poverty. And we know that at least 150 additional million children have fell into multi-dimensional poverty just last year as a result of the pandemic. And it's not just the big number, which is by itself alarming and really asking us to rethink how we're going to address it, but also who are those children and what is the new dynamics that we're seeing in terms of children living in poverty. COVID, but also the compounding impacts of climate and conflict has highlighted that we're looking at maybe 3 groups of children that have been particularly affected. Those that were already living in poverty, most of them in rural areas, and also, as I mentioned, in context of conflict, fragility, and displacement. Children that were able to emerge from poverty before in the recent years that are now very quickly falling back, or children who had not experienced poverty before and are now falling into poverty, creating what we call a new cohort of chronically poor people, particularly, of course, in middle income countries or in families that were part of the care economy or the informal economy. And a crisis that is projected to also increase inequality between and within countries in the long term, with a particular focus on some groups such as I mentioned, the informal sector, youth, and others. And this is on top, unfortunately, to the many issues that Professor Sachs also alluded in the beginning, that it's not just a monetary poverty issue, but on top of many impacts across different social sectors, exacerbating a learning crisis, interruption on health and nutrition services, displacement, and even more exacerbating the crisis that we had in terms of care and gender-based violence. And this is, of course, looking from the, let's say, human capital perspective, but also the current and urgent question of the climate crisis adds more to this dynamic, and affects, of course, how children will be able to be affected now, but also the capacity to thrive as they grow older. UNICEF launched a recent report just some weeks ago around the climate crisis, focusing on the impacts on children, showing that 2.2 billion children are currently exposed to at least 2 climate and environmental hazards, shocks and stresses. And of course, you know, in a nutshell, showing that inaction today means just larger costs and larger impacts that cannot be reversed for our next generation. And I cannot talk about intergenerational equality without you also talking about our gaps or issues around social protection. As you know, as UNICEF, we're working very much in making sure that every child in every family is covered by effective social protection. We know very well from evidence that social protection plays a very critical role across different social sectors. It's been recognized as one enabler for reducing poverty in Agenda 2030. It's not just for children, it's a life cycle approach that we're definitely pushing and understanding the impact that it can have in breaking that intergenerational cycle of poverty. And I think in the context of COVID, was social protection was without doubt one of the key responses for the emergency. But the crisis was also very clear in showing to us that we still have a lot of gaps in terms of the social protection system, in terms of adequacy, in terms of comprehensiveness, very critically in terms of sustainable financing. Social protection was seen as a short-term emergency response with a lot of programs created, but a lot of programs that are still a risk of not being sustainable in the long term. And still very unacceptable from our perspective, gaps in terms of coverage. The latest report that we did with in the context of the ILO World Social Protection Report is very clear. Only 26.5% or 4% of children receive social protection benefits. Within the current context and with the current financing structure is, of course, definitely not acceptable. And it's not, I think that this data is not maybe a surprise for many. What I was trying to show is just the nuances of the changes and the impacts that COVID had put on the table. but also as a reflection. We understand that we have a critical issue. We understand and we know that investing in children, it's important, and investing in overall human capital is important. And it's not, it's not new, but I feel as we have to continuously make the case that investment in human capital is important. And when we're looking at what are the resources going, either in the context of an emergency response, or also in the context of what we can call some sort of an inclusive or a forward-looking recovery, we're still not in the right track. And I'm not going to go into all the different elements that I think should be enhanced, but I want to maybe focus on two. And the first one is debt. We are in a debt crisis. In many countries, that payments outweigh what government budgets focus and allocate in social expenditure. And if we're asking countries to do more and better and to be more specific and to make sure that we are addressing gaps, this is a very big challenge. A report that we did a couple of months ago was very clear, and even before COVID, 1/5 of lower and middle income countries spent more on debt service than on education, health, and social protection combined. So yes, we have agreements, yes, we have evidence, but as Professor Sachs said at the beginning, that the levels, the alignment in terms of financing from the public sector and also private sector are definitely not even close to what we're trying to do. And my second point is around early childhood development. We know very well that early investments are the most efficient, cost-efficient way to accumulate human capital and enhance capacities and maybe address some of the gaps that we have in terms of contribution, but they're not always, and in very few countries, prioritize despite overwhelming evidence. And just to show some of the evidence that we have from Eastern and Southern Africa is one of the critical regions where this could make a huge difference in just changing a little bit the dynamics of the country. And even prior to the pandemic, the gap around ECD on the resources focused on children between 0 and 6 are astronomical. And I know we have little time, and I like numbers, but if we can then, we can also share then the very specific report where those elements are discussed, and the cost of inaction also it's not just that this is a good investment and it's important because of the moral imperative, but also the cost of inaction and the missed opportunities if these are not adequately focused. And maybe just to close and also to open up for a discussion that we need to continue having at different levels, even though it's not a new question, I think it become even more urgent given the current context. We are in a discussions where we are trying to prioritize what do we focus on in terms of recovery. I many times hear a lot of emphasis and impetus around green recovery, and on the other side around inclusive recovery. We need to bring those two together. Green jobs are key, but without the appropriate human capital approach, that dynamic will be lost. So one, I think, big part of our work moving forward is to really put at the center of the stage the importance of prioritizing once more inclusive as well as green recovery and the focus on human capital investment. Protecting those social investments, even in the context of economic contraction, and that is not just key for human capital impacts, but also for enhancing the employability and contributory capacity of future adults and future citizens. But I think this is alluding to one of the comments that I saw in the questions, is not only about more resources, but also more efficient, more equitable, and more transparent use of resources. There is money that is going to different sectors, but unfortunately, sometimes those investments are lost because of not the adequate use of resources. Many programs that are working in tandem, and a lot of I think new space can be found if we put a lot of more emphasis in making those allocations that are already there and protected even more efficient. And being very clear that we're asking, as I said before, governments to do more with the same amount of resources, and therefore, what are the new financing options to broaden that space, either from the focus on debt relief and restructuring, but also to enhance the opportunity to more groups to be more effectively integrated in the labor force. What are the new family-friendly policies that we can put in place to allow caregivers, women, and others to be more actively involved in the formal labor sector? What are the opportunities to open space for young people to be adequately integrated into the labor force and start contributing and broadening, let's say, the contributory base that we have? So we have a call for action that we released some time ago, where I think it's important to put these different elements on the table, not necessarily new elements, but elements that sometimes have been not put at the center stage of our discussion. And in a pandemic that is, like, for our perspective, offering us a big challenge, but also an opportunity to change a bit the way that we are prioritizing critical investments for children with this intergenerational perspective. And I'll stop here. Thank you very much.
Thanks so much, and I congratulate the presenters on their great timing, and thanks if you can stop sharing. Camilla, let me, so thanks very much. Great talk from both of you. Camilla, did you have a comment you wanted to share? Perhaps we can begin with you. I haven't seen your hand up. Excuse me, I mean, yes, it is. So there's, yeah. I received a note that Camilla was going to ask a question. All righty, in the absence of that, you would need to unmute, Camilla, if you are trying to talk to us. If not, I think it might be interesting too if you panelists, and if Camilla comes on, then let me know. We have received a couple of questions, and let's begin with one of those. And also, if you both want to, like I say, touch on each other's presentations. One issue that may seem a little focused, but it's very of great interest here in the US and elsewhere, is that this sense of vaccine disparities may increase, as the commenter suggests, so with the opening of schools. So that, especially in countries where the Delta variant is surging, there's going to be a tremendous emphasis on getting vaccines in kids, and may even create more of a discrepancy in terms, or even more of a shortage for older people. So do either of you, Peter, maybe you might want to start. If you want to respond to that questioner?
Well, I think what we certainly see in countries like India is that access to vaccines has primarily been about whether you are wealthy. It's had very little to do with your true levels of vulnerability to becoming very ill or dying of coronavirus. And so I think I think the issue should be looked at in terms of age, because age is such a critical element of that vulnerability, but it simply isn't. So I think then to say, well, the lack of coverage in parts of the USA or in large parts of India could create more tensions between the concerns about vaccinating younger people in school and vulnerable older adults, I think is probably a bit of a red herring. But Natalia may well have a different view about that.
I think that is one of the most difficult issues right now, the issue of vaccine inequity, right? We have, as you know, UNICEF have been working very hard in trying to make sure that that is closed. But as Professor Sachs said at the beginning, we're working with the resources that we have at hand, and which are not enough, even though we know that they are excesses in some countries. Those excesses are not always distributed evenly. We do have a very massive gap between regions, and until we cannot, if not everybody is protected, it's very difficult to then have that level of immunity and that we're trying to have. So I think that's our continuous call to identify and to call on a broader perspective on solidarity, but also from a public health perspective. If we don't have the ability to cover all of the different constituencies of the countries, it will be very difficult to think about any source of recovery, even from a health or a socioeconomic perspective. So yes, that continues to be, I think, our more concern and a main call from UNICEF in terms of vaccine equity.
Great. We have another question, which touches on what Natalia said, but was asking, I think, for a follow-up. And this questioner says that the questioner agrees with Professor Sachs that money is not being directed where it's most needed, especially in terms of educating children. But from this person's experience of the expenditures of third world countries, one of the major challenges with the little money they receive is misuse of the funds through corruption or mishandling of some kind. But that may be a bigger issue than we can deal with, and it certainly would apply to all age groups. Is that an issue that either of you has another response to? That is, how the money that's being allocated may be being misused?
Well, I think my argument's always been that certainly in many low and middle income countries, the issue has been a combination of vaccine nationalism and vaccine ageism in most countries. And they're equally deplorable, and they're equally responsible for primarily huge numbers of deaths of people at older ages. And I think we're all responsible for that in different ways. That said, I do know, for example, in South Africa, that the rollout of vaccines was extremely slow, and that was more due to internal political issues that I don't really want to comment on, but I'm privy to, than it was to the fact that the vaccine wasn't simply in country. And in South Africa, they did want to prioritize older people, but they just couldn't make it happen for all kinds of tricky reasons.
Maybe from my side, and maybe from a broader social spending, I think one of the priorities that we have in our work in public finance is not just protecting spending, advocating that we need to have more for social spending, but also working with governments to make sure that that allocation is efficient, it's transparent, that we have a lot of calculations showing that we can definitely find additional resources just with a better allocation of the existing money to more efficient programs, to better targeting, to better use in that sense. So that's one in terms of efficiency, but also helping countries to show that to have the mechanisms to hold transparency in those allocations, and work also with civil society organization groups in the ground to be able to also hold accountable governments for the use of those resources. It's not going to, from one day or the other, address completely all the issues of misuse, but definitely it's enhancing, let's say, the information that citizens have available to be able to also play a role in making sure the resources are allocated in an efficient and transparent way. So it's a big part of our work and our interest, including the call for action that I mentioned in my presentation.
And Peter, maybe you could add a bit. This relates to a question that we just received about the role of civil society organizations, nonprofits, and others to advocate or be involved in general, and also in terms of providing direct services. Someone who I think is from that world asking what their role should be in promoting this kind of intergenerational awareness or equity. So do you have a general thought on what,
Yeah, a couple of quick things. I mean, firstly, I think clearly that I do think there has to be much more cross-engagement. And I think these echo chambers, really do matter, and we have to find ways of cutting across them so that we can deal with these issues. And what I'd just like to add is that I saw there was another question, which I'm really glad somebody asked, from A. Moore. I feel we're dancing around the big issue. The younger generation, who face few health risks themselves, has paid a huge price in terms of education, development. As older people ourselves, which sadly most of us maybe are, I shouldn't say sadly, are we being too kind to ourselves? I don't know. Is lockdown fair or unfair? I do think that not vaccinating people over the age of 70 in the Philippines and vaccinating more people under the age of 50 is bloody unfair. Okay? And I think I've demonstrated that using quite strong language in a publication. And this is why we need some kind of way of deciding what is fair. And COVID demonstrates that so much. So, sorry, that's a rather abrupt answer, but I'm so glad that question was asked, because that for me is the elephant in the room.
Yeah, thanks. And if you see me gyrating here, I'm keeping up with questions. So here's one that I'll share to see if you have thoughts. So one participant asks, given the problems with vaccine access and inequality globally, how can we fix COVAX? How can we free up the IP and ensure production and distribution? I don't know if you folks feel that's in your areas of expertise, but if so, would one of you like to take that one on?
Does it need fixing? I I think it's the question is a bit too broad. Now, what exactly are the elements that we need to fix? This is the part that is not reaching the amount of population that we wanted to reach. Yes, of course, and that's not an issue of fixing. That's an issue of being much more forceful and more and even continue to even more advocacy, more work, and trying to make sure that those countries that have the capacity to provide more vaccinations are doing it and making those commitments at a higher level. We had many governments that are starting to do that, but of course it's not enough. I think it's a facility that has worked in many ways in trying to make sure that we identify what are the best needs, and not only looking at vaccine delivery, but also understanding what are the costs in country to make sure that we have the surge in health providers, that we have the right resources to be able to also implement those vaccinations at country level. So it's also a comprehensive perspective, that it's not just having vaccines, but also the capacity at country level and the financing at country level to deliver that, which is, I think, the second part that we're trying to strengthen. We've had a lot of focus on we need more, but we sometimes forgot that we also have another challenge at country level in terms of capacity, in terms of absorption capacity, in terms of diversion of different financing from one sector to the other, because we had to focus on vaccination. And I think that's the second part, let's say, of the equation that right now we're putting a lot of emphasis and focus on resources for the actual vaccinations, but also for in-country capacity. So it's not a question of how to fix the whole thing, but some of the elements that we're trying to strengthen from that way.
A very specific challenge. Would UNICEF say that in high-income countries, we should not be vaccinating anybody under a certain age, so that vaccine that we're now using, which will have very little impact in terms of lost lives and ill health, should be taken to countries and given to the people who are more vulnerable to it? See, this is, to me, is the dilemma. And there's a certain amount of what we would call cakeism here. You know, you can't have your cake and eat it. And these are dilemmas, and I don't know the answer to that. But
I don't think we're saying that. I don't think UNICEF in any way will tell a country stop vaccinating an age group. But we're saying if there's accidents, if there's more vaccines than what you need to cover your population, that's the message. So it's not trying to say one age group versus
it's not
the
wrong
other.
to vaccinate a 12-year-old in my country or in the USA when that vaccine could be given to somebody age 60 in a very poor country. Because choices have to be made, and that's the difficulty we're always dealing with here. But anyway.
This would have been a great sort of starting off point. You know, before we come to an end, we've reached our time. But I wonder, to each of you, if there's one message, you know, like a short maybe in a minute or less, one thing you would like to leave folks with. Dr. Sachs left us on a slightly hopeful note. You don't have to, but any, you know, last point you would like to make? Maybe Natalia, starting with you.
I think the message that I've been trying to put for the table in many of this discussion is that this is a crisis we need to change into an opportunity. We have now focus. We have a renewed commitment around certain issues that before were not even on the radar, such as, for example, social protection, such as, for example, equity. This is the moment to really make sure that we are able to close those gaps, that we're going to be able to really identify and rechannel, let's say, our resources, and not continue to make the mistakes that we did in prior crises, in past crises, such as austerity or contracting budgets, but on the contrary, to making sure that we can and be comfortable in putting resources in system strengthening to be able to have a better response in the crisis to come, which unfortunately will come in the near future. So mix of a positive and a negative.
Thanks, that's wonderful. Peter, one last word?
Very briefly, yeah. On one hand, utterly sympathetic with that, utterly sympathetic with what Professor Sachs said, that basically let's just get on with it. Why are people like me coming along and asking rather academic questions? But on the other hand, I do think there's questions of fairness we really have to engage with them as part of that building back better from COVID, post-COVID, because intergenerational injustice, perceived or real, is a major issue for public policy in all countries in the next decades. And we have to think about it really carefully and do different.
Thanks so much. Thanks. This has been extraordinary. Wynn, did you want to make a final comment before we?
Just to say thank you very much to our panelists, Professor Peter Lloyd Sherlock and Natalia Winder-Rossi. Thank you very much, Professor Pelimer, and always to our support that is indispensable, Celeste and Gerald. this virus will continue, like really wants to survive. So I think this is part of an ongoing conversation and ongoing challenges that we'll have to face and address institutionally and also by expertise. So I'd like to thank everybody and stay tuned for our next Lancet COVID-19 and Global Development Commons webinar coming in the next couple of months. Thank you everyone for attending and giving us your time.
Thank you very
Thanks,
much, colleague.
everyone. Great discussion.
Yes.
Thank you. Goodbye. Take care.
Goodbye, everyone.